Could you walk us through what DPC is and just as importantly, what it's not? I wonder if some people are thinking, how does this differ from traditional concierge medicine?
Yeah, 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 yeah.
Clarify that model. What's the distinction? What is it and
So,
what isn't it?
the phrase that we use in DPC is if you've seen one DPC practice, you've seen one DPC practice, and they are all incredibly different. And that is my favorite part is that I get to make it exactly what I want and however I want it to be. And so I think one of the most important things to do is that it's not concierge. It is feels similar in terms of the like contact and the accessibility you have to your doctor. Concierge is typically where they charge a fee for the access, but then they also bill your insurance. And direct primary care is we have nothing to do with insurance at all. It also is much more affordable than I think most people realize. It's usually $70 to $100 a month, and most people are like assuming it's in the realm of 1,000. And so it's much more affordable than people realize. And then compared to like a traditional practice where you have to pay a copay or whatever, we don't do any of that. Um, so in my practice, how it works is our patients pay a monthly fee and they have access to us at all times. They can text us, call us, send us pictures. I right before this, I was getting a picture of, hey, this rash popped up. Do I need to be worried? What can I give? Was able to answer it in just a couple minutes. And they didn't even have to get up from breakfast, their lunch table, excuse me. And so you're able to just handle things very quickly.
Hmm.
And then our patients can have as many visits in a month as they want. And it doesn't cost them anything additional.
That's really innovative and it's truly impressive. It really is impressive that you have, carved out this niche. I think one theme that comes up when speaking with clinicians who have pursued independent or innovative care models is the gap between medical training and the realities of running a practice. We know that physicians spend years, right, mastering diagnosis and treatment, yet receive minimal formal training on operations and how to run the business, finances, revenue models. And, these are the very skills that can determine, right, how much autonomy they have in shaping their patient care. So for me, in my practice, nonprofit, home health, community health, one of the challenges and the joys of running a mission driven organization is balancing that financial sustainability with the desire to provide care that truly meets the community need. In our case, it's often unreimbursed care or free vaccines or wraparound services. I imagine you must face very similar opportunities and challenges at Bloom. How has running the business side of your practice allowed you to provide those kind of services? And why do you think it's important that physicians need to learn it?
So I think it's important. Oh man, that. So let's start with why do physicians need to learn how to run a business? I think anyone, whenever you work for a company, you need to know how it works at every step. And that's why I really enjoyed like starting my practice because I know everything from how to get the toilet seat to be fixed all the way up to how to get the billing correct, right? And so I think it's important to know how where you work, how things work. And with the business side of it, we get no training, none. I had no idea how to start a business. I had no idea how to do any of this, but we are taught how to seek out resources and find help. And that was something that I was able to utilize and talk to other people and create a network and be able to understand how to start a business.